Welcome back. Now, cancer does not have to be a death sentence. As we head towards the end of Childhood Cancer Awareness Month, the Childhood Cancer Foundation of South Africa says early diagnosis is imperative for favourable outcomes. It says the COVID-19 pandemic should not derail the fight against childhood cancer. Well, let's get some more on this topic. I'll chat to Hedley Lewis from the Choc Childhood Cancer Foundation of South Africa. He joins me. Hedley, good evening. Thank you for chatting to us. What are the most sort of common cancers that we see in children?
Well, I mean, there are various cancers that we're aware of, but I think that the most important thing is that regardless of the cancer within childhood cancer, it's imperative that early diagnosis is top of mind. And from us as a foundation, we're asking people to be aware of some of the early warning signs. So we developed in conjunction with the South African Childhood Cancer Study Group and the Department of Health, who are partners on a regular basis to raise awareness, to call on the public, and to realize that if children are detected early and referred early enough, that the diagnosis is a lot more successful.
And where are we with research into these various cancers, particularly in children?
Look, I think that globally there's a lot of research. We've seen a heightened research awareness within South Africa very, very recently. But regardless of the research around the actual disease, there are lots of social impact and areas that are really impacting on these early diagnoses. So traveling, areas that the patients may live, the psychosocial environments. And for us, it's absolutely imperative, as Choc is we're augmenting the support in the pediatric oncologies. I think that in South Africa, there's going to be a lot more research that's going to be done. Globally, there's a lot of research, but the research and a lot of the information that we're seeing globally is that early detection really plays a huge role in the prognosis and the long-term treatment.
Yeah, I guess what you're saying essentially is that it's very expensive to treat, any kind of cancer, I guess. Are there developments that are trying to bring those costs down?
Look, I think that the one thing that we're aware is that government is committed to childhood cancer oncology support. We have units across the country, and it's absolutely, it's humbling, specifically for Choc that travel around the country, and we have houses and transport and accommodation that are seeing these pediatric oncologies, where we're seeing that government is spending the money. They understand the support. But one thing that we are realizing from economics as well is that if you diagnose early enough, then you hopefully will have a shortened treatment plan, and the cost obviously will be reduced as well.
What always fascinates me whenever I hear the word Choc, I think of all you guys in your cow outfits with your bells at all the cycling races. I mean, what kind of things like that do you do to raise money? I mean, that's become iconic around the country with you guys in your cow outfits and your bells.
Absolutely. I mean, Choc's been around for 42 years. It's committed to supporting the Department of Health, augmenting the support. And for us, it's about having 13 houses across the country. It's about having psychosocial teams within the hospitals and the therapies. It's about transport, accommodation, and really how we support this infrastructure and this environment is one of the areas we have is the Choc House, which is probably one of the most well-known. And it's ladies, men's, gents, children that really have said that it's their obligation to help fundraise and support and augment the Department of Health to really make sure that regardless of the child or their family's economic environment, that they can have as smooth as possible, reduced anxiety as possible. And for us, it's really our privilege to augment government. But most importantly is for us to realize that sometimes this journey is long, sometimes it's short. And regardless of what direction that journey may take, it's our obligation to be there for that family.
I understand you're not a doctor, but if you can maybe, for parents out there, what are some of those early detection signs that people should be worried about or be concerned about should they see anything? What are they?
Absolutely. So we've developed, there's an acronym called SILAWAN. So firstly, it's S for seeking medical help. I is for making sure if there's possibly a white spot within the eyes. L, maybe lumps that maybe the parent is aware or the guardian. And then U is unexplained items. A for aching bones, and finally N for neurological signs. And if anyone's not sure of these or they don't pick it up in this conversation, choc.org.za is really there. And just as importantly, that we call on the public is they too can be part of the heroic impact, just as the doctors, the nurses have, by just either calling the number, which is on our website, or hitting that referral button, which is absolutely imperative to shortening or changing the prognosis, hopefully for the long term.
So all that information is up on your website. People can get it there. Is that right?
Absolutely. And the one thing that we're calling on the public is, regardless of COVID, is to make the right call, to utilize the website. But it's really everyone's obligation. If there's the slightest of a thought that any of these symptoms are top of mind, that they use our website, that they make the calls to the call centres and let the specialists take over from there, and give a clear direction of what the future may bring.
Hedley, that's fantastic. Thank you so much for joining us this evening, and thank you so much for all the work that you guys do. I know you put in a lot of hours trying to raise funds for Choc, the Childhood Cancer Foundation, and it is just incredible what they do for that as we almost wrap up Child Cancer Awareness Month. Let's take a look now at all your sports news.